started.
Yeah, cool. Thanks, everyone.
Yeah.
All right, everyone, welcome. Welcome to our Women's Health Incontinence Night. We're excited to have you all here. I'm glad you've got your tea and chocolate, Ray. That makes me very jazzed for you. You'll be nice and comfy. Just in terms of some Zoom etiquette, we're going to keep you all on mute.
That's not Michael, it's one of the...
entire night, and we'll just ask that you keep yourselves on mute for now. If you do want to ask any questions, we do want this to be really interactive, so please use the chat box as much as you want. We'll be keeping an eye on that as we go, and reading out any questions and answering any questions as we go along. Cool. All right, well, we'll get started. That side of it, good, awesome, cool. So firstly, a little bit about us. We are the Women's Health Physios of iMove. My name's Laura, and I'm joined by my two wonderful colleagues, Madison and Kelly, for the evening. Just a little bit about myself. I love treating women throughout all stages of their life. It's a real passion for me to be able to educate and empower women to move throughout all phases of their life, particularly in that pre and postnatal journey, and those women that are suffering from pelvic pain. But I'm going to hand it over to my colleague Maddie to introduce herself and chat a little bit about what she likes to do.
Thanks, Laura. Hi, guys. My name is Maddie. So great to spend the night with you tonight. Really similar to Laura, I'm super passionate about helping women understand their bodies better. So we do a lot of work with pre and postpartum, but we also do a lot of work with women who are in the gym, they're running, and they're experiencing pelvic pain, or like we're talking about tonight, they're experiencing leakage. So if we can just help you understand your body a little bit better tonight, that's our goal.
And I am Kelly, and I'm also a women's health physiotherapist. I work with women who experience pelvic conditions, and I also love helping women feel strong and confident in their own body. So whatever that might be for you.
Awesome. Yes, we're all about girl power and empowering you to be in control of your own body.
Woohoo.
So what do we do? So you've probably just got a little rough idea there, but the specific conditions that we treat are incontinence, like we'll be chatting about tonight, prolapse, helping women through their pre and postnatal journey and getting them prepped for birth, as well as what that looks like afterwards, and also pelvic pain, pain with sex, any of these sorts of things. So you would be coming to see us or reaching out to us if you're experiencing any of those. If you've just gotten pregnant, you're going through that journey, we'd love to help you. Or if you've recently had a baby, or just in general, if you're seeking information around your body, around your pelvic floor and what it is and how to use it, then we are here to help you with that.
Went backwards. Just wanted to see our faces again.
We do look good on that slide. So tonight is about incontinence during exercise, otherwise known as stress urinary incontinence, or we might shorten it to SUI tonight. So that is what we are talking about. So specifically, we want to cover your pelvic anatomy. So what's inside your pelvis, what your pelvic floor is, and what that does. We're going to be looking into the specifics of leaking with exercise. So what it is and why that might be happening to you. And then we want to go through some really simple ways and give you some strategies around how you can reduce this and how to use your pelvic floor and how you can actually prevent this from happening. So in order to get you all involved a little bit tonight and get you all talking, we're going to do a little fun true and false. So I want you to use the chat box here. I'm going to ask you a question, really simple, and just plug in there whether you think that that is true or false. Kel's going to read out, what sort of answers we're seeing there. There's no prizes if you get it right, so don't worry about any of that. So true or false? Incontinence is only experienced by women who have given birth. I'll give you a few mins. Well, good. I'm seeing some falses from people. Good. Yes. Awesome. So we've all already, most people are saying false, which is really nice to see. It is absolutely false. It is not only experienced by women who have given birth. We see it in all ranges of people who've never given birth, people who've had multiple children, all that sort of thing. Next up on the true and false is that is incontinence. Oh, Kelly, how are you going there?
Sorry.
It's all right. Don't be sorry.
Mm.
I'm just going to wait until it comes up so you can all read it. Cool. True or false? Incontinence is normal. I've got a couple of trues coming through, which is interesting. Cool. So, and a false, actually, yeah, it is false. It's not normal. So, there's this big misconception that it's normal. It is very common. In fact, 1 in 3 women will experience incontinence at some point in their life. But we don't want you to be going around thinking that this is normal. You should be able to be continent your whole life, and you shouldn't have to put up with leaking. And that's why we're here. We want to educate you around that and ways and things that you can be doing to make sure that you stay continent throughout your whole life. So no, for anyone who's thinking that that is normal, get that out of your brain. It's common. That's the word we're going to use tonight, but it is not normal.
So now we are going to get into the nitty-gritty of incontinence with exercise. The medical term for this type of incontinence is called stress urinary incontinence, which essentially means the involuntary leaking that occurs due to increased pressure in the abdominal cavity. Now, the types of things that cause this increased pressure is things like your jumping, squatting and big lifts, or your deadlifts, double unders or skipping, running, a variety of different activities. And it can even be things like sneezing, coughing, or laughing. So I'm sure some of you here tonight may experience leaking with some of those activities there. What exactly causes it, or why does it happen? Often it occurs due to the lack of support from our pelvic floor or other things that are supporting the bladder, like the urethral sphincter, which is a tiny little muscle that sits around your bladder and it helps it keep closed most of the time. Yes, it's really common, but as Laura said, it is absolutely not normal, and there are so many things that we can do to help you do the things that you love. So how can we help you fix or help you to reduce your symptoms? We can have a look at your pelvic floor and how it functions. We can have a look at other things that might be causing that increased pressure onto your abdominal cavity and your pelvic floor and your bladder. And we can also fit you with what we call a pessary, which we'll go into a little bit later. So the first thing we're going to have a chat about is the pelvic floor. I'm going to hand it over to Mads to have a chat about that.
Awesome. And just looking at the chat box there, Brooke, absolutely, you can definitely get incontinence with feeling like you're worrying or rushing and not making it to the toilet. So it's a different type of incontinence that we talk about. It's called urge urinary incontinence, and definitely it's another thing that we work with. What's everyone else saying? Sprinting, skipping, deadlift. Yeah, absolutely. Running's a really big one for sure. Sneezing. Yeah, all of the above. So before we go into what you guys can do about this leakage, what we want to chat about is some pelvic floor anatomy. So I'm really passionate about making sure every woman understands what their body looks like, what it does, because I think the pelvic floor anatomy particularly is pretty impressive. So if you look at this picture here, imagine you're looking up underneath. You can see you've got the urethra, the vagina, and then the anus. And then imagine you're pulling that superficial layer of pelvic floor aside and you're looking deep inside your pelvic cavity. So you can't actually see these deep muscles externally. This is what's inside. So you can see you've got a big group of muscles there. So a lot of the time, I think we kind of just think your pelvic floor is one big muscle. But what's really interesting is it's actually a really big network of muscles, and they each have a role and they each work to pull in different areas to give you that support that you need. So if we come on to the next slide for me, Cal, we're going to talk about what the pelvic floor actually does. So we know, and most people understand, that it's there to help you remain continent if you can, if you want.
Sorry, Mads.
So we want to try and make sure it's strong for that. But there's a few other roles that the pelvic floor has as well. So it actually has a really big job holding up your organs. So if you imagine inside your pelvic cavity, you've got your bladder at the front, and then you've got your uterus, and then you've got the rectum. So especially when you're pregnant and you have the weight of a growing baby sitting on that pelvic floor, it has a really big role in supporting those organs and holding them up. So that's its first role. We know that it sits from your tailbone at the back to your pubic bone at the front. And we know that it's supporting these organs, it's supporting your bladder, and that it's also really important in sexual function, which is something that I think is probably less talked about as opposed to leakage. And a lot of the time we treat women in the clinic for pain with sex, difficulty having sex, and then leakage with sex as well. So there's a lot of things that link into that. And obviously it's a really important and sensitive topic. So if we go through, what we're going to do is actually talk a little bit about what your pelvic floor needs to do. So everyone kind of thinks, oh, my pelvic floor is weak, I've got a bad pelvic floor. Well, we look at it like any other muscle. So just like you go to the gym to train your bicep or your quad or your general body, we need you to be training your pelvic floor, but we actually have a few different ways that we train your pelvic floor. It needs to be fast. So it needs to be really fast and come on when you do something like a cough or a sneeze, or you run across the road to grab something, grab your kids before he runs across the road, that kind of thing. We really need it to come on quickly. The other thing that we need is we need it to be really, really strong. But the really important thing with that is it can't just be on all the time. A strong pelvic floor is a pelvic floor that comes on, comes up, holds, and then it can let go fully. So a lot of what we see with the more of the pain conditions that we treat is that their pelvic floor is just constantly on. So that's not a really good functioning pelvic floor. We call it a dysfunctional pelvic floor. And in those cases, we're working on the full relaxation. And we can actually see leakage in those cases as well. So really important that you know how to fully turn on and fully turn off that pelvic floor. And the final thing that's really important is that you can coordinate it. We can do all the strength training in the world, but if you can't turn it on at the right time when you need it, that's when you might still leak. So they're what you need to think about in terms of your pelvic floor, and understanding that it really is like a big strength training program like it would be for the rest of your body. And it's definitely worthwhile investing in, because if you can get your pelvic floor working, coordinated, get it strong, you're going to really prevent a lot of things in the future, which is what we want.
Bit more than just kegels, hey Mads?
Just a little bit more. So we're actually going to run through what you would do to activate your pelvic floor, because I think that's always a bit of a misconception. And a lot of the time we're really encouraging women to come into the clinic, because sometimes you can think you're doing a pelvic floor contraction right, and then a lot of the time that's not what's happening. So if I can get you all to sit for me, imagine you're all sitting already, I'm going to get you to start with what we call some pelvic tilts. So I might just pull my camera down a little bit so you can see me. Basically we start with this. Yeah, Laura's going to be doing some too. So if you want to look at both of us, that would be great. My cable doesn't allow me to fit. So pelvic tilt, you're going to start just tilting forward, tilting back.
Yes.
And back. And all we're doing here is starting to bring some awareness into your pelvis. I actually quite like doing pelvic floor exercises in sitting, because it can actually give you a little bit of pressure on your perineum, so underneath, to kind of feel like you're lifting and then dropping open onto the chair. So once you've done your tilts, I want you to do a few, you feel like you're getting some really good movement. What we're going to use, and I guess the cue we're going to use to start with, is imagining that you're drawing a blueberry up your vagina. And this is the motion that I feel like I'm doing all day, every day, because I want it to squeeze and lift up. So if you close your eyes, I find that helps. I want you just to feel relaxed, take a nice deep breath in, imagine your sit bones are nice and wide. And then as you exhale, I want you to squeeze, imagine you're drawing a blueberry up into your vagina and pulling high. Hold, and then as you inhale, I want you to let it go and drop it open. Okay, I want you to just put into the chat box if you think that actually worked for you, because sometimes different cues work for different people. So if you can let us know if that one worked. The next one we're going to try is imagining you're stopping the flow of urine. So I think this one works for most people because we can relate to it. So imagine you're on the toilet and you need to stop a wee. I want you to try that one with me now. So again, you're inhaling, imagining everything's open wide. And then as you exhale, it's that squeeze and lift like you're drawing up urine. So holding your wee, holding up, and then as you inhale, you're letting it go. Okay. How'd everyone go with that one? Comment for me.
Got a few, so they went well, Mads.
Yeah, good. Yeah, I like that one. I think the really important thing with it as well is that it's definitely a squeeze. I think a lot of time though people forget about the lift and the relaxation phase. So every time we're training your pelvic floor, you want to get the squeeze, you want to get the lift, and then you want to get the relaxation. So the 3 phases is what's really important to avoid that dysfunctional pelvic floor. The next thing that's really important is that you actually know how to get this activation with breathing. So there's no point really having a good pelvic floor contraction if as soon as you try and breathe, you can't actually hold that contraction. So the last thing we're going to try is, if you choose whatever cue just worked for you, take a deep breath in, relax, sit bones wide, and as you exhale, think about squeezing the blueberry up or drawing up a wee. And then I want you to try and take a breath as you hold. So it's on, hold, breathe, and then fully let it go. Inhale, open wide. I think, well, normally what we find is that as soon as we add in the breathing, it becomes quite difficult. So if that's you, maybe post in that comment box for me. The other thing that we'd always want to see is actually how long you can hold it for, because you might get a really strong contraction, but you might not be able to hold that. So I like to use breaths quite a bit. It's okay, can you turn it on? How many breaths can you take while you hold it on? Okay. So that's like a nice little, I guess, example of what you would be doing and what we would be looking for. I'm going to hand over. Oh, no, I'm not. First of all, I guess the question would be, what do we do now? So you know you can activate your pelvic floor, you're getting a good contraction. What do we do then? So we look at the knack. So that comes back to the coordination that I was talking about before. You need to know how to turn that on before you cough, before you sneeze, before you laugh, so that you have this really well functioning pelvic floor. So if you're getting that strength really well, we work on coordination. And then we want to work on the pelvic floor in different positions. So there's no good doing it sitting, doing it on your back if you can't do it in standing or playing sport. So we look at those positions, and the girls are going to go through some different other cues you can use in these positions as well. And then, of course, we want to try and eventually then train that pelvic floor contraction with the activity that makes you leak. If you've got one thing that always makes you leak, we're going to train it. Okay. So I think, girls can take you through some of these other factors that you can work on now that your pelvic floor is 100% perfect.
So when we talk about other things that might put some pressure onto your bladder and your pelvic floor, we're not just talking about, anything. We're talking about very specific things that might actually increase the pressure and cause your leaking. One of the most common things that we tend to work on with women is, having a look at the way you move and the way you do your exercise, and then, okay, is there anything that might be putting a little bit of pressure onto your pelvic floor and contributing to that leaking? I guess, like with, if you are someone who leaks with, say, a squat or a deadlift or even a jump, one of the most common things that I see for women is that you tend to do one of 2 things. And there are obviously multiple things, but these are a couple of really common things that I see. So I often see women will go down into their squat, but they'll start to tuck this way and they'll arch their back. And what that does is they go into the squat and they arch their back, and they end up losing their brace position through the front of your tummy there. And you put a heap of pressure through your lower back, and then you put a heap of pressure down through your tummy area and down into your bladder and your pelvic floor. And that contributes to your leaking. Similar with your jumping or your skipping. If you're in this position and you're doing your jumping or skipping, then that's not a very useful position for you to be in as well. And that can contribute to your leaking if you leak with jumping. Another thing that I see is doing this with your squats or your deadlifts in particular. So you go down to lift something up and you're hunching over like this. You're putting a heap of pressure through your tummy area. And what does that do? It puts a heap of pressure down through your bladder and your pelvic floor. Another thing we tend to look at is joint mobility. Joint mobility is a huge one, and it really depends on what you need to do and why you need to do it as to why you get or what you need to do. So often for your gym goers or someone who needs to do a lot of lifting, hips, lower and upper back or ankles are really important and are really so vital for keeping you moving and reducing the pressure that you put through your body. And if you're a runner, I know there's a couple of runners in there I saw before, your ankles and your feet are super, super important so that you're not putting a heap of pressure and load back up through to your pelvic floor and contributing to that leaking. Another thing to think about is overall general strength. So yes, we need pelvic floor strength, and that's really important, but we also need just general strength of a lot of other muscles to be able to do what we need to do each day and with your exercise, so that we don't get increased pressure through other parts of our body and then through your bladder and your pelvic floor. And, you know, something that I can't comment specifically for each person, but we'd have to do a comprehensive assessment for you just to see where your little niggles or strength deficits are to figure out what you might need.
Absolutely, Kellen. It's so individual and so much more complex than simply just our pelvic floor. That's so important.
Mm-hmm.
That our technique comes into it, the way we move, our strength and mobility throughout our whole body. So even if you feel like you've done all the work on your pelvic floor, there is definitely other ways that we can help you control that pressure. And I'm just going to come back to sort of one of the comments from one of the ladies just talking about how the Stop the We cue has actually made her feel like she creates too much abdominal pressure and makes it worse for her. So definitely different cues work for different people. And if you're creating a lot of pressure through your abdominal wall, that's going to put even more pressure down onto that pelvic floor and make that leaking worse. So that's why the individual assessment is so important, to find what works for you, what helps you get that lift and squeeze at the most optimal amount that you can. So yeah, really hard, but definitely if you're feeling that, if you're feeling the pressure, if you're feeling like any of the cues that we spoke about tonight actually make you worse, they probably do, and they're probably just not the right one for you, and we need to find that.
Mm-hmm. And I think, like, you have to remember that, like, your abdominal cavity has, you know, sort of, I guess it's like a can, right? So you've got your pelvic floor at the bottom, you've got your abdominal cavity sort of around the middle, and then you've got your diaphragm at the top. So you sort of need all of them to work pretty well together so that you're not getting increased pressure anywhere. Yeah.
Absolutely.
Now, the last little thing I wanted to cover was a pessary. If I can get it to... Oh. So, pessary is a tiny little silicone-made device that a women's health physiotherapist can fit to you. And what it does is it sits into the vagina, and it helps to act like a backstop to help keep your bladder closed. Now, it is something that we might consider for some women, particularly where some of the other options aren't suitable or haven't quite worked in the way that we wanted them to, but it's a really nice way to help keep your bladder closed in the right times when you're doing your exercise, if it's something that suits you and is right for you. Now, obviously, all of these pessaries here are all different pessaries. The one that we might fit for you is the one on the bottom left-hand corner with the little knob. They're not as scary as they seem.
Not at all, actually.
So that's the pessary.
Yeah.
Any questions, ladies?
Pop them in the chat if you have any about pessaries or about anything that we've spoken about. But like Kel said, a pessary, you know, it's not for everyone, but it can be a really, really good, safe option.
Mm-hmm. Yeah, urge incontinence is another type of incontinence that is also very common for women to experience. Not exactly the same as stress urinary incontinence, but people will have both urge incontinence and stress urinary incontinence.
Yeah, I think the important thing is we do treat it a little bit differently as well. And sometimes there's some really good cues we can use that actually rewires your brain a little bit in terms of the urge. So if you do have a really strong overpowering urge that feels really frequent, or you get to the toilet and there's no way you can get there and make it, then that's definitely something we can fix. And normally it's actually easier to fix than stress urinary incontinence, I find.
Yeah.
One of the ladies says that they've noticed less incontinence with running once they started to work on their core and general strength this year, which is really cool. So that's awesome. Any other questions or anything? Does anyone have anything that they want to ask us while we're here?
We do have our contact details. Okay. Yeah. Do you need to go through the GP for a pessary? Absolutely not. It is something that you can come to us for, and it's something that we'll assess to see if it's the right option for you. So we'll do a complete assessment with you. We'll ask you all the right questions to see, you know, what might be causing your incontinence, and then, you know, we do a full body assessment, and then, you know, we figure out whether a pessary is the right thing for you, and we can fit it for you as well.
Absolutely.
Yeah.
Yeah, and it's a good option as well if you feel like you've tried everything and you feel like your pelvic floor is still not better. Well, then we want to look at everything else in your body, and if we still can't improve it with that, sometimes pessary is a really awesome option. How long do they stay in for? It depends. It honestly depends on what type or what we're trying to treat, what the goal of the pessary is. But sometimes we fit them and people wear them during the day. Sometimes we fit them and they can stay in for a whole lot longer than that.
Yeah, I have a lady at the moment who just fits it for when she's doing her running, and then she takes it back out again. So yeah.
So yeah, they can have ones where you just take them in and out yourself, you wash it, you do all that sort of jazz on your own, and then others where you can keep them in for a little bit longer. Totally just depends. And yeah, it also can sometimes be a bit of an interim thing as well, right, Kel? So you might find that we just use it for a little while to get you through your activity and as you work on everything else, and then you don't need it. But usually when we're fitting one, it is probably because you're going to use it for a while. Yeah.
And they're so easy. I love them.
What I'm going to do is you're more than welcome to keep asking questions, but I'm just going to go to the next slide, because the next slide has our contact details on it. So you're more than welcome to take a picture. You know, our emails are there, our Instagram is there, all our information is there, and you are more than welcome to get in contact with any of us. And we actually have an offer for you guys tonight. I'll just pop the link in the chat comment box. We've got a 50% off initial consult with either one of us if it's something that you'd like to come in and have a chat to us about. You're more than welcome to come in and have a chat to us, and we will help you with, just shared the link again, guys.
Just in case you wanted to jump on again.
Yeah, again.
Do it all over again.
Kel will post that. You should all get a recording of tonight's chat as well, I think, after.
Yeah, and some more info in an email about how to book in. And if you can't come to any of the clinics, so I'm in Clovelly, Kelly's in Panania, and Laura's in Roselle.
Yeah.
If none of those are near you, we do online consults as well. So we can do an online consult. We can also tee you up with a lot of other great women's health physios. Yeah.
I'm just going to stop the share, and I'm going to find the link for you guys, okay?
And shoot that through.
Fantastic.
Kel. Well, we hope you all got a lot out of tonight. It seems like you did, and that people have learned some new things about their bodies. We look forward. We hope we get to hear from some of you. So feel free to email us or chat to us. There's also some good women's health info on our website as well. We've got a little ebook and a few little blogs and that you can jump on and have a look at if you're wanting to just, browse a little bit more and learn a little bit more.